morning, everyone. We're going to go ahead and call the Public Health and Safety Committee meeting to order. It is Wednesday, October 23rd at 9:30, and we're in the Holiday Building. Thank you all for coming. Looking at who's here, dispense with introductions and get started on the meeting. Our Councilman Duncan is going to be slightly late, so I'm going to change the order of the agenda a little bit so that everybody's here for your presentation. Hopefully that won't delay you all too much. With that, Karen Hiller, Chair. We've got name tags here.
Christina Valdivia Alcala, District 2.
David Banks, District 4.
And we'll have Councilman Duncan from District 8 here shortly. First item on the agenda is the approval of the April 16th minutes.
Move to approve.
Second.
Moved and seconded. Any discussion? All in favor say aye.
Aye.
Minutes are accepted. We'll skip presentation for the moment and go to our action item, which is item number 4. And everybody should have in their packets a copy of the proposed changes. The issue here is that we have discovered that the section in the Topeka adopted version of the International Property Maintenance Code is unclear about what happens and who's responsible in the case of a situation where a tenant's unit is infested in a multifamily property, and then as time passes, multiple units are infested, and who is responsible. So the document that you have is to fix that. We had very much appreciated some help from the city attorney's office to take a run at amending what we'd had from 2012, but we went ahead and looked ahead. John Chardine is here, the head of the department, and he is looking at bringing forward soon the full review of the IPMC that we have now to update it to the International 2024 code. So we checked the 2024 code, and their language was exactly what we needed. So what you have in front of you is a proposal to change out the section on pest elimination to the 2024. Councilwoman.
Thank you. I just want to make sure that there's remarks made at this committee level for anyone watching or anyone that will be watching the recorded meeting, is that this is so timely that we are putting this in motion, and thank you to Chair and everyone else that has helped with this, because what we are finding under the Changing Our Culture of Property Maintenance, we already have had issues where we have kind of had to sit on it, code has had to sit on until we get this straightened out, where we understand, even though I will mention no multifamily dwelling names, we understand that there are issues in some multifamily dwellings with bed bug infestations, possibly roach infestation. This goes beyond an individual tenant's living location and has caused infestation problems, to where there are now outside organizations that go in to serve particular populations of need in some of these multifamily dwellings are not entering the premises because of the issues with infestation. And so what this is really pushing for, and Chair Hiller really pushed on this quick, is that we're going to get down to the nitty-gritty of this and deal with the problems across this city where there may be infestations of the type that I've just mentioned, and that these property maintenance folks and the LLC owners are going to need to get up and get moving on it, because these are intolerable living situations and folks should not have to go through this. So again, thank you for all your work on this.
Councilman, thank you. Councilman Banks, any questions? In particular, just so people know, I'm not quite sure how it got through last time, but there was a 30-day time period in it, and it also did not address when there was multiple units affected by the infestation from one unit. It just talked about anybody being responsible for what was going on in their own unit. This new language says that where more than one unit is infested, the tenant and landlord are responsible. And it's not any more specific than that because it depends on the circumstances. If that tenant is still not keeping their place clean or bringing in stuff off the street that's got bed bugs in it, they got to stop doing that. So they have some responsibility, but once it gets into more than one unit, the landlord has got to step in and take care of pest control, either on just a couple of rounds because of a particular issue or long term. So that's the big change. I think Councilman Duncan is aware of this. In the interest of time, what we want to do is, as Councilwoman Valdivia-Alcala said, get this moving. We've asked the staff to get it stubbed in for the next council meeting, which is November the 12th, if it passes out of this committee. So I would entertain a motion to approve this and move it forward.
A motion to approve.
Any further discussion? All in favor say aye.
Aye.
Opposed, same sign? Nobody left? All right. Thank you for that. Hopefully Councilman Duncan will be here soon. Let's go ahead and, unless you want to wait a little longer for Councilman, I'm not sure what his schedule is.
Schedule should have been to be here. I don't know if there was other items that we can get to, any dialogue right now before we actually move over to the social determinants of health. If you don't think so, Chair, then we'll just go straight into it.
Let me cover just a few things that I was going to mention under updates, and hopefully he'll be here by then. Overall, for the full committee and those who are here, I think you're aware that because the changing our culture of property maintenance movement is so big and requires steady attention, we actually have meetings twice a month. Once with the lead team, which is Councilwoman Valdivia-Alcala and me, and now Nicole and John, and then also a marketing team once a month to work on the education and public information elements that we're working on and community engagement elements. Monique is part of that group as well. And then for the leadership team to work on the policy pieces and make sure that the whole movement is in order. I would say I want to welcome Nicole Stovall. We have been without a project manager basically for over 18 months. And so we are pulling some things back together. We have way more moving parts than any of us hoped we would at this point, but we really appreciate having Nicole on board. With that, she is working on updating the overall master work plan that we have, getting it current, as well as doing some work on setting the performance measures once and for all. That has been riding without our management team, or our manager here. So working on that data collection, I am hoping that this committee can meet again on the 20th of November. Does that work for you all? That would be a month from now. Nicole has assured me that through our leadership team meeting in early November and the work that she's doing to pull this together, that we ought to be able to have a report with some of the data, performance data, by November. So I already mentioned that we're working on the IPMC. John, if we can actually have a calendar from you by November in terms of how you'd like to address that,
Sure.
That process. I know that John's planning to have staff input on updates and so on. We'll be looking at the current version of what we're determined to rename the Topeka Property Maintenance Code next time.
Correct.
And have staff input as well as some public input. So
I'm going to ask for assistance from the Shawnee County Landlord Association,
okay.
and then possibly the president of the Oakland NIA, who I feel is well qualified to review some of the suggested changes and adoptions. I value his input. We've met a couple of times, and he's got some good ideas. So I'm still seeking other input, maybe creating an outside independent review board to look at what we have. And then I bring it to you guys, and then you look at it. This is the 2024. So after we make it to PICA's in our best interest, then we'll move forward with it.
That sounds great. I'm thinking that you're looking at maybe a 6-month process, and so...
I hope to wrap it up quicker than that.
Okay.
As soon as I get commitments from the folks I need commitments from, then we can start moving forward.
Well, if we could have that calendar by next month, that would be great.
Sure.
We can share it. Yes.
How large were you thinking about this review board possibility?
I was looking for 4 members, 3 to 4 members. Steve, what's the president of the Shawnee County?
Vogel.
Vogel. Steve Vogel had shared some interest in the past.
I think so.
He may have somebody in mind. It's important to us as a city to have valued input from our landlords and our residents. So once they see what we're proposing and the changes that we're making, because it has changed quite a bit, it's even realigned the chapters. So once they see those changes and they like what we're doing to it to make it work for Topeka and our occupants and visitors, once we get that buy-in, I think we're going to move pretty quickly.
Okay.
Super. And I think Housing and Credit Counseling, I know that we learned when this issue of the bugs came up that they'd asked to see some changes, and they observed that some time ago, and it didn't get anywhere. So
Right.
They're aware of the kinds of concerns that people have as well. So, but there may well be some neighborhood and community people that would like to do that.
Sure.
I think we've done that before. John and Alan Stahl from the fire department have also very much activated the affirmative apartment inspections, and so we should have some data on how many you've gotten and how close you are to your goal by next time. Chair.
That would be for the November meeting?
Yes.
As well? Okay. Is there any possibility too about getting a report, in-person report from HCCI? If not, that's fine, just bringing it up.
It's possible. Part of what Nicole's working on is getting the data in terms of how many people HCCI has seen related to our retaliation and code compliance processes, how many have gone to Kansas Legal Services, how many have been seen, how many tried to apply to the city. What we have run into that we'll be working on and be better prepared to report on some options is that every one of the referral sources asks you to fill out some information online, and then they'll see when they can see you. And we've had a lot of people that needed help right away. So part of our lead team issues this in a couple of weeks will be to see if we can figure out. Monique's looking into some alternatives for us to see if we can get somebody who's boots on the ground that can answer a call same day and at least get it screened and routed if not answered.
And I say that to add to what you're already talking about, because I think that would be, the end of the year meeting, and it would be a good way to end the year for folks that are watching, to see the highlights and to get kind of a compact version of where this very large program is.
Thank you. Thank you for that. Part of what we've started working on, we'll spend a little more time in the lead team meeting on, is just the issues of waivers and process and how we're doing on what we'd intended, which was to shorten the process for everyone involved, not have as many go to court, not have constant extensions in court. So we will be looking for those. That data is on her performance list as well. Mowing and vegetation, we've done a preliminary review on that. The number of calls, Monique had reported the number of calls went down this summer. We are thinking that the fact that we have had some public education, but also that we have had the list of possible contractors with the pricing that they would charge. What happens is we give that information to people and they don't call back. And so we're going to look for the data. John is now fully staffed at code compliance for the first time since anybody can remember. And so we know that there may be more violations just because they were able to write up more cases. But we're going to do our best to analyze that in terms of comparison to years prior. So we've observed with retaliatory evictions, again, that the safety net is taking some time to access. We will be working this month too. The observation is that sometimes tenants need money back out of this whole thing. We're doing the best we can to prevent, but if they've suffered or if they've had to move or chosen to move, there are losses in terms of maybe having to pay higher rent, having moving expenses, things like that. And so we, at our last meeting, committed to getting a video together on how the small claims court process goes, so that how to prepare and how it goes, so that not only can that be a benefit, an added piece for our website and our counseling network, but that people can see it whenever they need it and share it. So that's something that has emerged. We're checking. We ran into sort of a hornet's nest on a property that had a lot of problems, and turned out it was supposed to be, there was a lease involved, but there was also a contract for deed involved. And so the issue of when is a contract for deed really a contract for deed or an escape from being a rental situation, how do we apply the retaliation and the standards clearly there? And so City Attorney's Office, I think Amanda's still on, they're looking into some ways that we can flesh out whether a contract for deed is, whether we can say it's not really, it's not recorded. If it can we say locally that if it's not recorded, then we don't recognize it as a contract? Maybe, maybe not. We're looking into those. Also trying to make sure that when contracts for deed do exist, that they're on the public part of the Shawnee County Appraiser's website, so you can tell that there's an owner, that there's a contract. Yes?
Thank you, Chair. And I hope as these discussions continue, because thankfully, Habitat came to us
Yes.
with this, and Habitat is deeply involved in a number of these issues with the contract for deed, and was the catalyst for us to start having this dialogue. I also believe that, continuing to work with Habitat in partnership can only help the folks of Topeka that are facing these egregious situations. We are looking at, one owner that is said to have possibly 400 contract for deed properties in the city of Topeka alone, and that there are allegations of a lot of different abuses. And so I think that the time is ripe for us to be looking at this as a city because of the change in our culture of property maintenance. But as you bring up the county, I think that this is also going to be imperative that the county come on board with these conversations, and that the state also come on board, perhaps through our Shawnee County delegation, to how in some particular pockets how rampant this situation is. So I think it's another responsibility this committee is being, that's being put upon our shoulders.
Yes.
But this is the best fit to me of where it is, where it's headed, which is here. So thank you.
Yes, and the other angle that Amanda and I talked about the other day was whether we can seek or do our own legal interpretation, that if in fact it is a contract for deed, does that bring it under the state law that requires a disclosure statement of any flaws in the property in a real estate transaction, so that at least it would force that documentation in the transaction. So, and therefore a document of disclosure. So we'll see on that. Neighborhood profiles, that's part of our charge as well. That was to have positive profiles of each of our organized neighborhoods, to to then be a kind of a collateral document for them with the health maps telling what's wrong with the place and what bad things have happened there, but a profile that talks about its culture, its assets, that has pictures of the housing styles that are there and the activities that people in the neighborhood have had, and so on. So we've seen a couple of drafts. We appreciate the Planning and Development Department getting that going, and we have some assistance from the Greater Topeka Partnership on those. We have seen a couple of drafts, and it's not quite there yet, so we're working on making sure that they are fully representative of the qualities of the neighborhoods before we go on into finishing them up. They're looking at a pace of doing them 2 at a time over the course of the next year. So when we've got show and tell, we will do that. Vacant properties, the land bank folks, Spencer, who's not here, as well as planning and development, have been working on some of those issues. They have done an industry developer roundtable. Just at the last council meeting, there were 2 items passed that should help for redevelopment. One being an increase, slight increase in the allowable densities on properties, as well as allowing more flexibility in the setbacks. It turns out that those proposals were intended particularly for large, vacant, undeveloped parcels. They don't really apply as much in our neighborhoods because they're already platted and so on. But we did learn that anybody's lot size is buildable in Topeka, even if it's still a 25-foot lot, that they are all grandfathered in. So as we're kind of doing foundational work on redevelopment and vacant properties, those are some steps that have happened. Also, the neighborhood revitalization program was just renewed for another 3 years with some really great benefits, especially as property values are rising, therefore the tax increment is getting bigger. It's a really good time for people to do infill construction or major rehab on their homes and be able to take advantage of that. Property maintenance, John again and fire are working together with the city's new Tyler Technologies software. We had been wanting to do an inventory list of vacant properties. They have been focusing on structures, but have committed that we would have land, vacant lots, as well as structures. Rather than try and do a master list, what they're looking at doing is being able to combine, and John, help me if I'm doing an outline of it, but maybe there's more. The fire reports, their database, the police database, and the code database, so that if something happens at any property, those with the security permissions to get into that information would be able to see when and if somebody's been in that property, something bad happened there, and so on.
Correct. That's going to include public works also. So there'll be a master database for contact information and address information. So anytime any one of those our employees of those divisions touch that property or that person in a file, that will be recorded and that information will be kept. So at any time, if we're involved with a property of interest, all the information will be there for us. The last time anybody touched it, what they did with it, where it stands at, and this applies for the court system too, which is most important. Because if we get in there and we see that there's 15 cases still in court, nothing's been done about this, obviously they're not going to do anything about what we need done. So we might want to actually push our cases forward, expedite it one way or another. So that can play an important, so many different levels and roles.
I have a question.
Yeah.
So on these particular addresses, are we going to make sure that the information stays in there beyond a 5-year period? I mean,
I don't know what the retention policy is for certain cases, but the information will stay there.
the information will
Yeah.
stay. Okay.
That's a really good point to make sure. Because
So-
each department gets to write their own, so y'all ought to put that on your list to make sure it's an indefinite retention or more
Oh,
like
for
a
the
10 or 20
information,
year.
contact information, absolutely, yeah.
I am just strongly encouraging if you could do that, because
Yeah.
this whole thing of dumping after 5 years is just not
Well, and
helpful.
also don't forget that it's fluid, so if a property changes names, it's got to be updated on a regular basis. So there's a whole report that gets downloaded.
Yeah. Thank you. Go ahead.
This is just a question for my information, John. A couple of weeks ago, maybe 3 weeks ago, we had a fire that destroyed a home on 17th and Buchanan. And the business owner right across the alley from that home has approached the city about turning that area into a parking lot. And it seems to me that, I know we have ordinance in place that says, you know, we don't usually do that, but this guy has a thriving business in our city, and we know that once that home is demolished, it's simply going to become a grass lot.
Correct.
But I think that in looking back at these similar situations, would we consider allowing that person to do the parking lot on an individual basis and not saying, well, if we do it for one, it's going to happen for the other one, for other people are going to want to do the same thing?
So it's my understanding that the person that you're speaking of owns the business and owns that house? Okay, so he already owns both properties. So it'd probably be in his best interest to move forward with demolition and rezone the residential for possibly using it for parking. That can be done, right?
Well, Rhiannon's on, I think, or she was, yeah.
Yeah.
Special use permits are sometimes preferable if a neighborhood doesn't want the downzoning to happen. But
Right.
Rhiannon, you want to pitch in?
Sure, yeah. No, I'd be happy to chime in. So yes, in this situation, just given the way that the property is zoned residential currently, it would require conditional use permit. It sits between two other residential lots that currently have structures and homes on them. So it's not that it's impossible, but there is a process to be able to turn that into a parking lot. So we could work with them through the CUP application process that would come in front of the Planning Commission.
Thank you.
Thanks.
Well, my
Thank you.
thinking is that the two neighbors, the guy that owns the business does not own that property. Those neighbors are going to be happier with the parking lot than they would be with the grown-up grass area there. So, I mean, if we're looking at making things nicer, just nicer, I think we should probably be looking at that process.
I see your point. I think it would be in the best interest of the community and the city to make sure that this gentleman follows the processes and goes in front of whatever group he needs to go in front of and convince them of, what he needs to be done. So,
Thank you, John. Thank you, Chair.
Sure. Yeah, we've got lots of redevelopment to do. And again, it's going to change different neighborhoods. Another piece that we've been working on, again, the whole vacant properties thing has been kind of fractured because we've not had the manager and we haven't pulled a team together, but various people are working on different pieces of it, and one of them is a mothballing advisory. And so that has been put together and it's on its way to the website, right, Nicole? Just some generic guidelines for if you are intentionally planning to hold a property vacant for a period of time, here's some things to think about doing to take care of that property. And so that's moving along. We still need to work on tax sale changes and alternatives. Our small developer roundtable that came out of our very early input hearings, as well as really an overall redevelopment program, which is going to be beyond just our changing our culture, but we don't have one. And so that's going to emerge as certainly a recommendation from us. Our website and handouts are reasonably up to date. Nicole, do you know if the things that you've provided have been posted yet? No. Okay, we've got a number of items in. Nicole also has an arrangement with the Spanish translation gentleman in the city government to get most of the pieces translated as well so that they're in Spanish. And we have resource packets that are available. Many of those pieces are online, and then Monique and her group put them together as handout packets whenever there's an opportunity, basically, right? So I probably forgot some things, but as I scooted through, both as the convener of this, just to make sure we had a list. Anything else to add? Want to give a shout out to Councilwoman Valdivia Alcala then before we close this part. She's been very active on Timberley Apartments and others in terms of engaging. Sometimes it's not just our local players. And HUD in that case had simply allowed some of the deterioration of that complex to occur without intervening. Same with the state organization. So you've done some great advocacy.
Thank you for that, Chair. I think that what we're going to find, and my goal is eventually to have a more open report, but there's a lot that is happening that needs to happen behind the scenes. Suffice to say, though, you are extremely accurate when we talk about since 1984, HUD has had control of this property through the HAP contract. And its continued diminishment over decades and decades has now come to the point where we're at now. HUD's lack of involvement, I have been very blunt about to them in the biweekly meetings that we have with a number of folks that are here right now. KHRC, Kansas Housing Resource Corporation, has also been part of that dialogue. They have also dropped the ball in a huge way, and I just want to reiterate again, if it would not have been for the input of Senator Jerry Moran's office, both at the state level and at the DC level, we would not be where we are right now. And that is sad to say, that it takes having to get that high to start for movement to happen. The bottom line is with the city of Topeka that has articulated that over and over again to KHRC and to HUD is that the protection of the tenants and for the maintenance issues, which have often been deplorable in nature, to be addressed. So this is going to be a long-running story. As soon as we can bring something openly to this committee, I think it's going to be important to do it because I think that it's going to help lay the foundation for us knowledge-wise, if we run into this again. So thank you.
Thank you for that. John, anything else to add?
Not particularly about Timberley. I will like to mention really briefly is that we've had issues consistent with Timberley over at Highland Park, and we were very aggressive in addressing those issues because we learned from Timberley. There's certain things that we took for granted that weren't going to happen again, and when we did identify it happening again, we got the people involved that needed to be involved. One of the names is Dale Banker. And Dale oversees a property management company locally. So he was invited to take over that property, and he immediately went in and aligned all of his assets to address the crime issue, the trespassing issue, the vacancy. But there's a ton of vagrants just hanging around. So he had them removed. And then PMU went in there and addressed all the vehicles, all the trash, all the rubbish, all the issues with any type of structures. And then Dale contracted security, and they went in there and did their thing. So based upon all the collaboration, I just came from a meeting with the police department where crime in that general area dropped 52% within the last 45 days based upon everybody coming together.
That's great.
So I want to say we did learn from Timberley. And we're applying what we learned over here at Highland Park. We're still doing what we can with Timberley. I have 8 cases still in court, and it's happening today, as a matter of fact, at 1:15. So,
Thank you for your service, your collaboration, and we're still building this jet in the air. Some of the pieces as we discover them, but it's exciting.
I did just get the text from Spencer. Someone hit his car. He's on his way right now.
Oh my gosh.
I don't know.
Well, I think we need to move on. Was anxious. Yes.
Thank you, Chair. John, I'd just like to make a comment. Highland Park Apartments is in my district, and I go over there frequently, and that is excellent news to know that we're on the upward swing for that area, because it is a much needed area for moderate to low income people, and because of the crime and the people that just decide that they're going to move in there, the empty buildings, and that is wonderful news. Thank you for your work, John.
Well, I'll piggyback on that in that the owner that is now, I guess, in jail came in, and I guess with the appropriate math that the fair market rents could be raised the rents there substantially as it was falling apart. And Highland Park has always been a really great place to live and a great resource in our community. So, especially if you're having to pay more rent for it as well. Good grief. Okay. Well, let me hand off to you. We'll go ahead and start this collaborative public health presentation.
Okay.
And hope that Spencer gets here shortly.
I just want to say before all of this is that this is what we talk about when we talk about intersectionality, not only when we understand as a committee, when we look at the whole of Topeka and what we are tasked with doing as a committee, but when we work within community with activists, with advocates, with other partnering organizations, to see that there is more that we need to do as a city to help make this the best place to live within our control as much as possible. So because of the immense amount that I have learned over the past 4 years, I understood that we needed to get to a point in this committee to have the dialogue, the needed dialogue that can help in the future to drive some of our policies, looking through the lens of the social determinants of health and looking through the lens of public health, which that embraces. So it really is something that I'm grateful that Teresa Fisher, who is the director of the Shawnee County Health Department, is here with us today. She will go ahead and make some introductions for a presentation we're going to have, and I hope that this is the beginning of a very fruitful and intentionally driven partnership. So thank you.
Thank you, Councilwoman. Good morning. I am Teresa Fisher, and I'm the director of the Shawnee County Health Department. And we are very excited for this opportunity to be able to present today on the social determinants of health. For some of you in attendance, this may be the very first time you're hearing some of this information. And for others of you, it may be multiple times you've heard it. But I hope that you all walk away with at least some more information today as to how this could apply to public health as a whole. I am going to actually be introducing our speaker today. Craig Barnes is joining us virtually. Craig serves as the division manager for our Community Health and Outreach Planning Division. So social determinants of health are truly what embodies Craig and the work that his group does for the health department in our community on a daily basis. And then also in attendance with me today is Danielle Twimlow. Danielle serves as the chair of our Community Action Team, which is focused on infant mortality and is a part of our fetal infant mortality review. So Danielle and I have known each other for a long time, and then I've had the opportunity to work with both of these individuals through the recent community violence initiatives. So again, I'm very excited to present today on this topic, and I'm going to turn it over to Craig.
All right. Thank you, Teresa. Thank you to the committee. Excited to be here, virtually at least. Apologies with the rescheduled date. Out here in Fort Collins, attending the National Safe Routes to School Conference, actually with a member of the city staff. So excited. We're already working on collaboration and looking at innovative and creative ways to get kids actively engaged in walking to school. So I think I saw the slides pulled up. I don't know if I'm sharing those myself or if you guys are running the show there. Either way works for me.
If you want to screen share, that's fine.
Can I do it here?
Yep.
Can you guys see it?
Yes.
Looks like I have sharing capabilities, so I'll go ahead and drive it here. So, okay. So again, thank you. Appreciate it. The opportunity to be here. As Teresa said, this is really exciting. And And really, for us, as the Shawnee County Health Department, Topeka is the largest municipality in Shawnee County, obviously. So it's exciting as an opportunity to work across the street, across the parking lot, if you will, and look at some future collaborations here. So I know we have a short amount of time, and we're already running a little bit behind, I think. So I'll try to stay as focused. For those on the committee that I've had the privilege to work with before, they understand full well the passion I have for public health. So sometimes I can go off on some tangents. So I'll do my best today to not do that. So I thought I'd...
Craig,
Yeah.
just so you know, our meeting is until 11. And so you don't have to
you shouldn't have told me that.
80 miles an hour. We'd like to have some conversation about how this applies to what we do afterward, but not all in 12 minutes.
Yeah. Well, and I think you guys have the slide deck in front of you, so that is the end goal on that last slide, is to really talk about next steps and capturing momentum and moving forward. So perfect. Okay. Well, so I thought I'd just kind of start off. So what is public health? We wanted this to be really a high-level conversation. So I think C.A. Winslow, he is the founder of the public health program at the Yale University. So he put this quote together back in 1915, and I think it still really applies to the work that we're doing 100 years later. So public health really being the science and art of preventing disease, prolonging life, promoting health through organized efforts of informed choices for society, organizations, public, private communities. And I think the biggest things to hit on there that's so important that we've been talking about, I would say in the decade plus that I've been a member of this community and working in public health here in Topeka, Shawnee County, has been fostering that collaboration. There is a lot of amazing work that's happening in this community, but Topeka, similar to a lot of other communities, sometimes finds itself working in silos. And so one of the big things that we want to do as public health professionals is work with our community to try to find ways to bridge those perceived barriers, those gaps, chop down those silo walls, and figure out ways to leverage each other's capacity, funding opportunities, and work together to make positive health outcomes. So what you see here on this slide here is just a little kind of a graphic that I put together that kind of in essence talks about what a simplified public health approach is. And so for us, when we look at this, we start to the left, this is kind of a segue into the next slides, but we do surveillance. That can be sentinel surveillance, syndromic surveillance, environmental observation, among other types, but in essence is to determine what is the problem. And so from there, then when we identify either an issue or a potential issue, if we're being proactive, then it is to look at the root causes. And a lot of times when we look at risk factor identification, that's where the social determinants of health really come into play. So what are the causes and what have we identified from that surveillance? And so from there, the goal is then to move into interventions and evaluations. What works? And so as public health professionals, we're really big on not recreating the wheel. And not only that, but also trying the best to share our stories and figure out what are the best opportunities, interventions that have worked in other communities. Understanding full well that City of Topeka is not Wichita, it's not Kansas City, it's not Chicago, it's not Denver. We are unique, but that's not to say that some other communities, whether it be in Kansas or the nation, don't run into the same issues, the same barriers, the same gaps, and we can learn from those. And so for us, we look at gold standards, specifically look at other health departments, what they're doing that are also accredited, similar to our public health department, has FAB accreditation status, and honestly ask questions. Routinely through the programs that I oversee, it is our goal to share our successes and also learn from successes from other programs that do similar work across Kansas and in the United States, similar to what we're doing today here out in Fort Collins, Colorado, as a part of the National Safe Routes to School Conference. From there, then the essence is the implementation. The last piece of that is the response, how to do it. And so People like me, we get really excited in those first three steps, the data gathering, the planning aspect. And then, that last piece is for those doers, those really passionate individuals in our community that take those action strategies that we've identified and put them into play. And so implementing strategies that have had success in other places, piloting those here in our community, and then again, evaluating success, which brings me right into the next slide here, which is the public health wheel. And so this here, in essence, outlines what the three core functions of public health are. So you see those on the outside: the assessment, the policy development, and the assurance. And the nature of the wheel, which was developed by the Department of Health in Minnesota back in the 90s, is to show that public health is cyclical in nature. So it is a continual QI process, which is, I think, exciting for a lot of us that work in public health. It doesn't stop, right? We're continuing to evaluate, we're monitoring. The big pieces that excite me really on the policy development piece is the education, kind of what we're doing today, the informing, empowering our community to make changes, be civically engaged, mobilizing those community partnerships, and in turn then looking at policies, developments, or what we call the PSEs, the policies, the systems, and the environmental changes that will have sustainable long-term positive health impacts on our community. So what you see on the inside, kind of what I kind of tied to there is, so those are the 10 essential public health services. And so those are the areas in which we as a health department strive to ensure that we are working within and continuing to look at opportunities within our community to engage with unique partners. I have a slide a little bit later that shows a nice graphic that showcases a healthy community. But to me, again, some of the most important work really happens in that policy development core function because it's the education and it's the mobilizing those partnerships to make positive health outcomes. So moving on to the next one, this is where we really I want to kind of start diving a little bit more into the social determinants of health. So I believe the committee is a little bit aware of this through the different community groups and organizations that you serve on and work with. Today, we kind of do a little bit of a high level, again, overview into this. What you see here is the updated chart that came out as a part of Healthy People 2030. In the past, there have been a wide variety of different social determinants of health charts that kind of try to extrapolate what are those root causes, what are the social, emotional, and behavioral and environmental factors that encompass those. And so this is kind of the condensed version of all of those charts. And I think the one that you'll see predominantly moving forward that public health professionals and individuals working in this realm will showcase. And one of the things that I think is really important to share about social determinants of health and studies that have been happening over the last decade that have really drove this thought process to the top is that studies are showing more and more now that nearly 20% of an individual's health is actually related to their genetic code. And closer to 60% of an individual's health is related to those 5 factors that you see here related to the social determinants of health. So there's been this saying that we have been using here as a part of the Shawnee County Health Department and through our public health grassroots coalitions is that an individual's zip code nowadays is more important to their health than their genetic code. And I think that's one of the things that you see in our community. I don't think we're any different than a lot of the other communities across Kansas and across the nation. And a lot of that work is we're highlighting as a part of the assessments that we are doing in our community. And I know, and I believe that each of you received a hot off the press copy of our newly published Community Health Needs Assessment for this year. That was actually just published last week. you all are actually the very first stakeholder committee to get a copy of that. We are doing a soft launch starting with this meeting today, and then rolling into later this fall. Actually, well, fall's not that far away. It's in November, doing a larger release of the community health needs assessment. So as a whole, social determinants of health, really what they are, as you can kind of see from this chart, are the conditions in which a person is born, in which they live, they work, they age, they play, they worship. And so all of those, in essence, have an effect on an individual's physical, but also mental health. And so one of the most important things that studies and research continues to show, and kind of the onus of this, the underlying message of this entire this update to you all, is that to impact social determinants of health, because they are complex issues, that takes an entirely collaborative technique. And so it ensures that we need to, as the county, as the city, as not-for-profits, as public-private partnerships, the business community, that we're all working together. And so that's the segue into this, in this next piece, is the healthy community. This graphic I found from the CDC is a great showcase of all of the different sectors that intersect in our community to make a community healthy. And for those that are in attendance that have heard me speak at whether it be our town halls or at other conferences, the big thing that I always kind of get on a soapbox talk is I'm happy to have a conversation with anybody about the work that they do if they think it doesn't impact public health. And one of the big things that I am always sure to talk about is, no matter what it is that you do, the work that you do, whether that is in your personal life or your professional life, ultimately will have a roundabout impact on the health of your community, whether that's the community as a whole, whether that is your direct family or those that you work with. The work and effort and what you do within that professional and personal environment ultimately has an impact on the community's health as a whole. And so when we look at this, I'm going to backtrack to this slide again. One of the things that we as a public health department is we subscribe to this adage, this philosophy of Public Health 3.0, which includes this thought process of the public health strategist. And what that means is that we have to work together, that health departments alone cannot be responsible for the entire health outcomes of a community. They can help drive and inform and provide the backbone, technical assistance, and data to support initiatives. But in essence, they need to be able to serve as a liaison, as a conduit, as a catalyst for change by figuring out creative and innovative ways to find those intercepts between all of these different sections of the community. As I kind of alluded to earlier, one of the big things that that I have realized in my decade plus in public health is that we sometimes fall back into what's comfortable and what we know, and sometimes that can be working in those silos. And so as a part of the health department and as a part of Live Well Shawnee County, which is our grassroots health coalition, is to really pull us out of those areas, to look at ways to have conversations across the street, down the block, and leverage each other's capacity for whether that's for joint grant applications, to leverage funding opportunities, to look at pass-through grant opportunities. For example, there are opportunities that health departments are eligible for funding that not-for-profits or other community partners might not have access to. But if we can work with those community partners to put together a comprehensive and superb grant application, that we can pass through funding to make positive health impacts. That's something we want to do. We don't have to necessarily drive or do the work, especially in the opportunities and situations where there are already trusted agents and content expertise in the community. We need to empower and embrace and elevate those voices to a higher point in the community in which they have either a better opportunity to reach more voices, more individuals in the community, or provide the funding and the backbone resources or the data to support those initiatives. So what is that looking like right now here in our community? And so I just took a snapshot of just a couple of different assessments and plans that we have in our community right now. And so, as I kind of already alluded to, you all in front of you have our brand new, hot off the press 24 community health needs assessment. This has really an exciting endeavor. You can see from just even the title page on the cover there, the number of partners that have come together to serve on the steering committee to drive this work. For our last assessment in 21, our steering committee was just 3 real partners, 4 partners, I apologize. But we have broadened that to now include Grace Med as our FQHC, both of our community behavioral mental health centers in the community, as well as now both of our regional healthcare systems. So that provides us a better access to data points to put into the assessment, better ability to push out information as it relates to the assessment. And so excitingly, as a part of this piece, and I know it's in the assessment itself, but I want to highlight this, we were able to, as part of our primary data collection, which is to put out a community perception survey as to what the community sees as the issues related to community health, we received over 3,800 responses from the community. To the best of my knowledge, that may be the best response to any community perception survey that has occurred in Topeka and Shawnee County. At least that's the information that I have received. And so that's really exciting for us. That to us as a steering committee and as a board for Live Well Shawnee County shows that the community is invested. They are very interested in what the impacts on the community health can be, what the outcomes, and how to then shift that narrative towards positive health outcomes for our community. What the assessment then does is we identify priority areas based on the data that we collection. So for this iteration of this community health needs assessment that we just completed, we identified 4 priority areas. And so that's behavioral health, which includes both mental health and substance misuse, neighborhood safety and housing, which is a new one for us. This elevated real high up in not only the perception survey from the community as at large, but then also through our roundtables, as well as through the secondary and tertiary data collection. So this is a new one that'll be in our next chip, and so we're really excited about that. The third priority area being food security, notably focusing on healthy food options and access to healthy food for our community. And then the fourth priority area being health equity, which is going to focus on STI rates in our community, infant mortality, maternal child health in our community, as well as obesity rates. And so those will then inform what will be our next community health improvement plan that will start working on the development phase in this next calendar year as we also enter into the last year of the current iteration, which is the graphic that you see in the middle of the slide deck now. And so we do these community health improvement plans and needs assessments on 3-year cycles. And that is a part of both public health accreditation and hospital accreditation to constantly assess the community and then to develop actionable strategies with our community. And so what we are excited and what we feel so great about in our community is that the strategies and the opportunities for implementation in those interventions that are developed in the Community Health Improvement Plan are developed by the community as a whole. These are not interventions that are just thought up by a steering committee and then just plugged in and we hope work. These are interventions that are developed by action teams and work groups that are a part of Live Well Shawnee County. Teresa, when she introduced Danielle Twimlow, she works on our case action team, which is also our Healthy Babies work group, as well as a part of Live Well Shawnee County. And so that is a work group, an action team that is working regularly to determine, analyze data, and look at what are those possible interventions that can have a positive impact on the negative infant mortality rates in our community and ultimately improve birth outcomes. The last assessment that you kind of see here, I just pulled out as just an opportunity, as just an example. And so one of the things that we were really lucky to be able to do was to secure some funding through the Kansas Department of Health and Environment and their Chronic Disease Risk Reduction Grant, was to partner then with our Shawnee County Farm and Food Advisory Council, which in essence is like a food policy council for our community, to do a more comprehensive dive into food insecurity in our community. So we partnered with the Kansas Health Institute and published this report in 22 that did a little bit more of a dive into food insecurity rates, access, food deserts, and things of that sort, in turn of hoping us, or hopefully helping us develop those tangible interventions. And so there's a lot of work that's happening on the back end in relationship that's already occurring as it relates to access to farmers markets, double up food bucks, so doubling SNAP benefits as at farmers markets. So you can get double what you would normally get, as well as opportunities for WIC benefits and things of that sort. So there's a lot of really good work happening. And all of that, as that catalyst, is kind of being funneled through Live Well Shawnee County. And so as a board member right now for Live Well Shawnee County, one of the big things that I want to push is, if you're not familiar with Live Well Shawnee County and all of the plethora of different work groups and action teams and partner organizations that work with them improving health outcomes, that's a conversation I would love to have with you to figure out where your passions lie as it relates to improving health outcomes. I assure you we can find a action team and a work group that is working on some of those areas as it relates to impacting social determinants of health and positive health outcomes in our community. So that's just a little snapshot of some, not all. Again, I want to make sure that I preface that some, not all, of the assessments and the work that's happening in our community to guide and direct the work towards improving health outcomes in our community. So all that to be said, one of the things that I do feel very confident about is there's a lot of momentum in our community. We had a lot of momentum in 2019 heading into 2020. Then we had a worldwide pandemic that I think kind of stymied, if you will, some of the community engagement, some of the work and the progress. We learned a lot through the COVID pandemic. And it also showcased a little bit more to our, I would say, not our surprise, our frustration on the back end, that the COVID-19 pandemic exacerbated some of those longstanding issues and those disparities that were happening in our community as it related to positive health outcomes. And so that's really where the last, I would say, 2 to 3 years has been assessing that. And then from there, determining where to move towards and reforging some of those partnerships that we had prior to the pandemic. And we have an entirely new environment, whether that's remote working, people in the office, new startups, different funding sources. And so we're still always evaluating what those look like. So, but one of the things that I think that is important again is, I would say as of today, October 23rd of 24, we are excited again. We are seeing a lot of that momentum and excitement towards, again, improving public health outcomes. And so from that, my questions, as you can see here, is, as we look to continue this collaboration, not only as the county and city, as a representative of the health department, but also as a representative for the board of Live Well Shawnee County and our partnering organizations that work with us through that. What can we provide to the city of Topeka to help inform decision making? What processes do you all have in place, or that can be either improved or maybe created or expanded? What opportunities are there for collaboration? I talked as I started. One of the exciting things that I've had and I've always been appreciative of is my opportunity to serve on the Complete Streets Advisory Committee through the city of Topeka as a representative that supports health outcomes as we look at both the pedestrian and bicycle master planning processes. The Safe Routes to School has been a passion of mine since we did a pilot project in 2014. I was shouting that off the rooftops when we were able to get that work moving again and then publish a Safe Routes to School plan in partnership with USD 501 earlier this year. So what are other unique opportunities? We don't know everything, and we don't know what we don't know. And so excited to explore any and all opportunities for collaboration. And then ultimately, as a committee, public health and safety as a committee, what are the impacts that you want to see? What do you want to accomplish? And, what supports can we, either as a health department or as a grassroots health coalition, provide to you all, whether that is standing line item on agendas moving forward as a part of this committee to provide updates on specific areas of interest to the committee, or whatever that may be. So with that, I think that's the end of my piece. I know that was a lot. I think I updated this slide probably 100 times to figure out what all to cover without trying to cover everything, which you can't. But I will open it up for questions, thoughts, and then also for Teresa and Danielle there as well.
This is Christina Valdivia Alcala, and thank you for that presentation. I know we only have 20 minutes left, so I'm going to spout off on a whole bunch of things based on these questions that you asked, so maybe we can get down some notations as we move forward in the future. But to me, it's starting now. Number one is that this cannot be our only conversation. This is like, to me, 1A, and then 1B should be having you guys visit with us again, so in an open, transparent way, we can start discussing how some of the initiatives that we're already moving on in the city through this committee can intersect with what you're doing and starting to put these pieces together. The other thing is that I can say is that as our partnership develops, and I'm totally down for the partnership, never, ever, ever to have it, at least in my opinion, on the city side, go down the way that it did with COVID, to where we basically had one person, well, maybe a couple of people on the city side, no offense to former Mayor de la Isla, but she was basically the person that communicated with, Shawnee County on everything. I don't know how others that were on this council felt at that time, but basically as a city council, we were pretty much in the dark about a lot. We would get little bits of information here and there, but working together and moving forward, understanding your public health, the county is the county, we're the city, but to have that flow of information in emergent situations to be more back and forth and not to where we're like in this little, silo going, what the hell's going on? You know what I'm saying? So hopefully that can change as well. I believe that it is imperative that we do a similar presentation to the full governing body about what we are trying to do and where we are trying to go after we develop whatever we're going to try to develop more. Because without the governing body's buy-in, none of this is going to work. The governing body's lens has to widen, in my opinion, as well. I would also, since we're talking about silos, one thing that we're trying to do with our legislative lobbyists is really, and this is run through Councilman Duncan's, he chairs the Policy and Finance, but really is pushing hard for much more aggressive legislative agenda, but also I keep bringing up, we need to be talking to our Shawnee County delegation more. And if we can start talking to our Shawnee County delegation more together as we put these pieces together, then we can't say that we're not doing everything we can to break down the silos. Because it's really, really important to have them in the know. And a lot of times, I don't think they are in the know on a lot of these things. So, a presentation together, to them would be wonderful. I see a multitude of ways for collaboration to take place through, the dialogue on food deserts, the dialogue on crime, because especially now that we're getting ready to hire a new police chief, the police chief, in my opinion, and I'm going to be requesting this from the city manager, that the police chief, whoever is chosen, be given this presentation because they need to have an understanding of it. We all understand that Civic is a program that is trying to get off the ground because SAVE did not work as it was promised that it would. We know that we have a problem with violence in the city of Topeka and the homicide rate. We know that we talk about wanting to lift people up and have them become engaged in this journey themselves and not just do it for them. Well, Civic is an example of that. So these are just a few of the things right off the top of my head that are coming forward. But Craig, I really appreciate the presentation. And, Danielle, just real quick, and then I'll stop asking questions for anybody else. Can you tell me what our infant mortality rate is again in Shawnee County?
Yes, so we actually did just get numbers that came out more recently. As you know, we have rolling data. This is part of your CHNA that you should be able to find as well. So recently, while the infant mortality rate in Shawnee County did reduce a little bit, so we went from 8.8 to 8.2 to 7.9. I believe was our last August update. However, the really concerning piece about our infant mortality rate, which the goal of being 5.0 per 1,000, we are definitely above that, so we're not at that 2030 goal. But the really concerning piece of that is the disparity of infant deaths. So we at one point saw a pretty significant difference between Black African American babies dying at 2.5 times the rate of white babies in our community. This last report pushed that disparity to 4.7 times the rate. So while the infant mortality rate for white babies declined, which brought our overall number down, our infant mortality rate for Black and African American babies in our community rose significantly. And for those of you that remember back, I think 2015, 2017, the We Are Wyandotte movement, because of their infant mortality rate really bringing a lot of attention, we're on that cusp. I think what's really kind of tricky a lot of times is how does health, oftentimes we get asked, how do we impact infant mortality rate? Like, what are we needing to do? We do things like provide safe sleep environments, provide education, wearable blankets. We're doing all these things which we know are impactful. But if I could quickly just anecdotally give an example of how we don't often realize how these things really do intersect. And where, Craig was doing such a really great job of making sure that we understood these social determinants of health. A couple years ago, I was actually able to contact Monique with the situation of a client that I'd had who was experiencing a lot of trauma and a lot of things going on in her life where she was doing the very best that she could, had recently had a child death, and a newborn baby that she was taking care of 5 kids by herself in a 700 square foot home. And after having the baby, she knew all the things. She knew all the safe sleep, the ABC. She knew all of the things. But as we were talking, realized that she was in fact sleeping with her baby in the bed, and not just sleeping with the baby, but sleeping with 2 toddlers in the bed. And eventually the discussion of, it's the only way I can keep everyone warm. I've spent all the money I could making sure this one room is warm. I could buy enough plastic to cover these windows. I've used a blanket to block the door, but I don't keep it like super hot, but my windows are super drafty, the door's broken, the landlord won't fix anything, my heating bill's over $300, which was well beyond what she could ever afford. So what we were seeing is we had an unsafe sleep situation, not because she didn't know or not because she was just being negligent, but she was doing the best she could to make sure that her and her babies were safe and warm the way she thought they could be. And so I was able to actually call Monique that day, and they rallied up here, and we were able to get her a kit to be able to get the rest of her house warm. We made sure she had a safe sleep environment and the things that she needed to be safe. But that intersection of making sure that we're having, landlord accountability for fixing up houses, the, situation where we have, such a large percentage of people who are not living in affordable housing. It's more than 30% of their income. That's where we also see those policies and the practices that we can do within council and within these committees that do then impact the health of our community. So it does intersect in a much bigger way, and that's why this is really exciting to be able to look at the way that we're doing these practices, these policies, and these ordinances with that public health lens.
Spencer?
Yeah, so obviously as I digest this over the next few days and read through it, I'll have follow-up questions, which I will definitely send. And I do hope, to Councilmember Valdeviacolo's point, we do this so we can check in with those questions and see how the data is going. I guess here's a question/suggestion. So we've got the social determinants of health, we've got the collaboration public health chart, and then you've got your 4 priorities. And all of that's great, although I would argue that universities, tech schools, and school districts are missing from your community health chart, but that's just but I think if I'm one of these organizations, one of the things we have tried very hard at the city to do, is to make sure we're not duplicating resources. And what resources we do have, okay, how can I support what's already in the community? And if I need to create something new, is it the right new thing? So if I'm one of these in your collaboration in public health, I think they have the same questions. How do I fit into the social determinants of health, right? So I would be fascinated to see some sort of chart develop that takes those social determinants of health, then takes your next chart and shows which categories they fit into in those social determinants of health, right? Because healthcare delivery system's not going to help with housing, right? But they're going to help with a couple other categories. And then how does that fit into your 4 priorities? And the reason I say that is that way, if I am one of these organizations on the collaboration in public health and I'm seeing this data, I can say, okay, I can help in these 2 areas, and that's where I need to go talk to them about putting my resources, as opposed to them saying, oh man, this is a lot. Where do I fit in to this, and how can I actually help? And I think that would help distill it, because I think that's what we find with a lot of groups is, I want to help, I don't even know where to start. And that might give them a point to say, hey, it looks like I can help in housing, or I can help in community health, or whatever your determinant of health is, to start that conversation. So just a suggestion, and that may change as I look at it more, but because I think the charts are great, but I think it'd be nice to give them a little more focus so those groups know where specifically they can direct their resources as they get into it with you and us. So just a suggestion as I look at all the data in front of me today.
Craig, did you have anything before I said? I just want to make sure, Craig, did you have something? I was just going to say.
Oh, I don't know that I necessarily have anything to add to that. I think it's a great suggestion. I think that's one of the things that we try to do as a part of the community health needs assessment process in the CHIP is to identify the organizations that we're aware of. I think, as I had mentioned earlier, one of the big things is we still don't even know all the great organizations that are doing great work in the community because either they may not have a voice or they're working in a similar area that another one is. And so it's great. I think, Councilman Duncan, you made a great point. And that is just a hard process of trying to evaluate all the amazing organizations that are happening. And then, yes, overlaying with social determinants where they can have an impact, I think is a tremendous idea. And that just furthers the conversation because then you can look at finding those organizations that may be doing duplicative work. And then can those groups intersect together to leverage either the limited capacity or the limited funding that they have to make larger impacts. So I think it's a tremendous suggestion and something that we'll definitely be looking at doing.
And just follow up on that real quick, I will say too, I think that's the direction that then helps us as a city understand where we should direct resources because, and I'm just using this as an example, but there may be a point where you come to us and say, guys, the community is doing really good right now in education, access, and quality. We've got that between what we have in the community. But we're really failing in, social and community contact. So could the city really look at, here's the data for that. As you have these pots you need to deal, please direct them there because you guys are going to know that way more than we're going to know that as to what those resources need to be directed to in the community.
Absolutely. I think that's really exciting that you bring that up. I see a twofold to piggyback on that. That actually happens to be one of the goals of Cities United. So piece of the work that has been happening through Civic and the partnership that has developed with Cities United, which is a national organization that does assist cities in coordinating these types of things specifically. It is actually they're not necessarily focused. There's a whole separate entity that focuses specifically on the violence interruption piece. And their job is to come in and assist with de-siloing, working on those pieces to make sure we're coordinating efforts and that we are looking at the way to leverage the resources we have within our community in the most effective way with a public health lens. And so that's really exciting that we've been developing that partnership. We've had that first site visit, which we had some great feedback and we had amazing response from the entire community, from government officials, elected officials, even at the state level, organizations across the city who attended over the 2 days to meet with them and engage, as Craig said, that momentum of wanting to work together on this approach, on moving forward. And secondly, like kind of that other piece of that is it's also kind of understanding how do you fit in just generally. So one of the things that we had in our community that's kind of on its tail end through KCSL, Dana Book, was operating off of a CDC grant across the state where we were looking at family-friendly workplace initiatives. How do businesses, organizations, and larger entities, so the Douglas County government, 5, 6, 7, 8 other government entities went through it, as well as small businesses through large businesses across the state, about what can we do as an organization level, whether that be business or government, do to impact the health of our community. So we do have data that shows, flexible work schedules, paid time off, childcare subsidies. We know for every dollar that we increase minimum wage can directly impact upwards of 3% with infant mortality. So things that we don't think might be correlated because of that intersectionality, but we do. We have resources in place that we maybe aren't utilizing to, as Craig said, because that continued siloed work. So I think we're in a good effort of this being a way to start addressing the fact that, hey, we've got lots of things that we can pull together to kind of answer some of those things together.
I think I was just going to tell you, we only got 4 minutes left, so probably got to wrap it up.
Understood. I'm curious, we really hadn't intended to go through our updates first, as you know, but because you sat through them, are there some things that struck you as angles that we could link through to the work that you're already doing and the work that we're already doing? Any of you?
If no one's going to hop to it from there, I always love to talk. So, no, I think, that was one of the exciting things. Actually, it was kind of nice to pivot that way and hear some of the updates. And so I think there are a multitude of areas, especially with some of the housing stuff. I know we're working on safety concerns as it relates to multi-unit housing, through both our environmental health, but also through our health promotion programming. And so I think there's opportunities to engage. We are also, we're engaging with the Apartment Council, the Landlords Association, through those endeavors. And so, I would hazard a guess here that there are several engagement opportunities that are happening already that we're already working on together, but in different areas and different tangent lines. And so I think one of the things to kind of see, I think from our perspective, even just being in attendance, in these meetings more to see what's happening helps us find where some of those intersections would be. And then also, my curiosity is piqued is what other committee meetings does the city of Topeka have, or what organizations are you a part of that have some underlying impacts on health outcomes that may not yet already be thinking about what the work is that they do and how they impact health? Can we provide an input to look at a public health lens through some of those committees and or organizations and coalitions? And so I've already got 2 pages of notes here from this already. Okay. And so I'm excited to get back to town and start driving and working on some of those pieces.
Well, that's great. I think of 2 things. My mind's just spinning because, to read through this and just take some time. And I was involved in Complete Streets and Bikeways when LiveWell was long before it was LiveWell. But Councilwoman Valdivia, I think, can source a piece that we've referenced throughout. Maybe it's in Karen Black's study too. Just the impact it's the impact on health, but it's a physically measurable impact on anxiety level when you walk down the street and a block or a neighborhood is overgrown or run down, and it's just scary. The impact on the blood pressure has been measured. So if you don't have that in your repertoire of resources, certainly it would be there. I also, as I looked at your distribution, one of the things we've been wanting to work on is, as we talked about a little bit earlier, just getting the word out and knowing that it needs to go out. You can do what you can do to get information directly to people through social media, public media, and so on, but otherwise the networks such as you have, so that the things we're working on, professionals in your network are familiar with, so that it can communicate on down. Do you have a separate communication distribution system from the one that the United Way hosts that has the 140 some folks on it?
So there still are lots of different ones that I would say that the Tuesday partner call is an example of an incredibly successful and initiative that has shown how collaboration is not only beneficial to our community, but has shown how much community needs that. So organizations continue to jump on this call every Tuesday, over 30 to 40 organizations every single Tuesday, to talk about the strengths, the needs, and upcoming problems that we can foresee, and how do we plan. Because again, we know mitigation, right? The more things that we can do as a prevention, the better outcomes we have. And so it is a way to kind of, everybody sees our community in different ways, some as boots on the ground, some on that higher policy level, and everything in between. And so that is an incredible place. I can tell you, like, for instance, Civic, we have been taking to door knocking. We have been knocking on doors in neighborhoods. And going back to the same neighborhoods and same doors, and engaging that way. And so multiple ways of connecting with community. We have our home visitors that come from all different organizations that connect with people individually. These awesome, I know Spencer mentioned, I think yesterday's meeting about the mobile units that have been coming out. I mean, the more that we get out into community, though, to reach people that these health factors are impacting is huge, and we're doing more of that. So we have both levels of that engagement. We have organization level, and then,
Direct.
people level, and I think we're doing a really good job at looking at new ways to do that.
Thank you. Do you have anything to add?
Yeah, no, I think I often use the terminology that there's no wrong door, and there's no wrong door to get involved in community and the public health impacts that we can all have. So you guys have heard a very high level about social determinants of health today. Again, we're very excited about this new partnership, what we hope will become a routine part for us to be able to share the information and ways we can work better. You've heard just a small portion of what goes on in our community. I think Craig hit it right on the head with the momentum. So we have so many people that are so excited at all levels there. We have a lot of people that want to first address the problem. We have the other group that we were joking want to head straight to, not doing the stuff in between. And so it takes all of us being at the table is what it really does. And so I think this is just a great opportunity that we've had to really foster communications about public health in our community.
Thank you so much. Well, I think on behalf of our team, I think all of us have taken this seriously, and we'll do our best to connect dots in terms of what you've shared and what we've been able to glean, or what we can read about who the other partners are. But similarly, if you would kind of feed back to us ways that you think that could connect in with the multiples initiatives that we have in our changing our culture of property maintenance. Our thought overall with that was certainly to change internally how we address those issues, but also change how the community saw itself and took care of itself and each other. So, anything else from the body? It looks like we will shoot for November 20th, same time, 9:30 to 11, for our next meeting, and lots to pull together. Thank you, everyone.
Thank you, Craig. Are we adjourned?
We are adjourned.